Hello everyone, my name is Dr. Ashraf and I'm going to present to you a case of aortic dissection and how it will be tested on an OSCE station. So aortic dissection is a tear in the aorta, and based on the Stanford classification, there's type A that involves the ascending aorta, type B that is distal to the left subclavian artery. Most commonly, we see aortic dissection in smokers, male patients who have uncontrolled hypertension. Other contributing factors can be connective tissue diseases like Marfan syndrome, Ehlers-Danlos syndrome. It presents with sudden onset tearing chest pain or a ripping chest pain. The patient can also complain of back pain. The pain can radiate distally or between the scapula. Um, it can present as an ischemic syndrome due to occlusion of coronaries like myocardial infarction. It can also present as an ischemic stroke. So, all very important to ask for weakness, numbness, loss of sensation. Patient can have sudden onset abdominal pain, the sign of mesenteric ischemia, and then ischemic leg, acute kidney injury. They can also present as shortness of breath, hemoptysis, as well as syncope. For physical examination, you ask for the vitals of the patient. Usually it will be hypertension, but it can also be hypotension due to bleed into retroperitoneum. Um, you have to ask for the blood pressure and specifically in both arms. So there will be an arm to arm discrepancy. You will also find a pulse deficit when you will be palpating the pulses of the patient. For example, if the left subclavian artery has a dissection, you won't be able to feel a left radial pulse. So you have to do a complete cardiovascular examination, including JBP. You check for pulses in upper and lower extremities, as well as bruits and carotid, aortic, iliac, and renal arteries. On cardiovascular examination, on auscultation, you will find a new diastolic murmur. So specifically ask the examiner that you're looking for a diastolic murmur. If you have time, you can do a gross motor and a sensory examination to check for focal new deficit. If you don't have time, just tell this to the examiner that you also want to do a neuro examination on your patient. For investigation, you do a ECG first thing first. Also send troponins to rule out myocardial infarction. You'll do a chest x-ray. You'll see a wide and mediastinum on that. If they ask for investigation of choice, that would be a CTA. If the patient has acute kidney injury or any contraindication, you go for a magnetic resonance angiography. You'll also order a transesophageal echocardiogram. In emergency, you'll do a fast ultrasound, basic blood workup, CBC, electrolytes, creatinine, and liver function test, and also send a type and cross match for the patient in case you need to do a blood transfusion for them. So this is a chest x-ray and you're seeing a widened mediastinum on the chest x-ray. For treatment, you have to stabilize the vitals of the patient. Always start from airway, breathing, circulation. For type A, you refer the patient to the cardiac surgeon for repair. And for type B, you do medical management starting with beta blocker, asmolol. So you won't be able to know that whether it's a type A aortic dissection or a type B dissection. So based on the chest X-ray, until and unless you get a CT angiogram of the patient. So you have to tell the examiner both of these treatment, type A and type B. These are some post-operative complications: renal failure, intestinal ischemia, stroke, and even death can happen. Thanks for watching. I hope this video was helpful to you, and please let me know in the comment section if you want me to cover any other topics. Thank you.